My respected brothers and sisters, my name is Dr. Fami, and it's truly an honor to be here with you all. Today I am excited to share some insights with you about poisons and antidotes. Throughout this lecture, we'll be exploring various aspects of poisons and antidotes, and I encourage you to actively engage with the material by taking notes and jotting down some important points. So without further ado, let's dive right in and explore the world of poisons and antidotes together. Thank you for being here, and let's make this a rewarding and enriching experience for us all. On the first slide, we're delving into the intriguing topic of poison. Now, what exactly is poison? Poison can be classified as any substance that, when inhaled, swallowed, ingested, or administered into the system, can cause illness or death. It's a powerful reminder of the delicate balance between therapeutic benefits and potential harm in the realm of pharmaceutical sciences. One of the fundamental principles in toxicology is that the dose makes the poison. This means that virtually any substance can be toxic if consumed in excessive amounts. Conversely, even substances typically considered poisonous can have therapeutic benefits when administered in minute amounts. This underscores the importance of understanding dosage and toxicity levels in pharmaceutical research and drug development. Poisons can take many forms, ranging from organic compounds to minerals, substances of animal origin, or even those derived from plants. This diverse array of sources adds complexity to the study of poisons and their effects on the human body. The issue of poisoning is a widespread concern globally, with millions of cases reported annually. Shockingly, around 2.2 million deaths occur each year as a result of poisoning, highlighting the urgent need for research, education, and prevention efforts in the field of pharmaceutical sciences. Understanding the nature of poisons, their mechanisms of action, and their potential therapeutic applications is crucial for safeguarding public health and advancing medical knowledge. Let's delve deeper into this fascinating topic as we continue our exploration of pharmaceutical sciences. Now that we've explored what poison is, let's delve into how poisons enter the body. Firstly, poisons can enter the body through ingestion. This means that they are swallowed or consumed orally. Think of accidentally ingesting a toxic substance or consuming contaminated food or water. Secondly, poisons can also enter the body through injection. This could involve substances being injected directly into the bloodstream, such as through the use of needles or syringes. This method bypasses the body's natural defenses and can result in rapid absorption of the poison. Another route of entry is through inhalation. This occurs when poisonous substances are breathed in through the respiratory system. Consider toxic fumes or gases inhaled from industrial chemicals or environmental pollutants. Absorption is yet another way poisons can enter the body. This involves substances being absorbed through the skin or mucous membranes. For example, certain chemicals or toxins can be absorbed through contact with the skin or eyes, leading to harmful effects. Lastly, although less common, radiation can also act as a poisonous substance when absorbed by the body. Exposure to high levels of radiation, whether from sources such as X-rays, gamma rays, or radioactive materials, can cause severe damage to tissues and organs. Understanding the various ways in which poisons enter the body is essential for developing effective prevention and treatment strategies. By identifying potential routes of exposure and implementing appropriate safety measures, we can help minimize the risk of poisoning and protect public health. Now, let's explore the classification of poisons based on their action. Firstly, we have corrosive poisons. These are substances that have the ability to cause destruction or irreversible damage to living tissue through chemical action at the site of contact. Think of strong acids or alkalis that can burn or corrode tissues upon contact, leading to severe injury or even death. Next, we have irritant poisons. These are substances that can cause inflammation or irritation when they come into contact with the skin, eyes, respiratory system, or digestive system. Examples include certain chemicals, fumes, or airborne particles that can irritate and damage the tissues they contact, resulting in discomfort or injury. Moving on, we have neurotoxic poisons. These are substances that have the ability to damage, destroy, or impair the function of nerve tissue, leading to neurological symptoms and potentially death. Neurotoxic poisons can affect the central nervous system, peripheral nerves, or neuromuscular junctions, causing a range of symptoms such as paralysis, seizures, or cognitive impairment. Lastly, we have cardiac and respiratory poisons. These are substances that can directly affect the heart and lungs, causing abnormalities in heart rhythm, respiratory distress, and potentially organ failure. Examples include certain drugs, toxins, or gases that can interfere with the normal function of the cardiovascular and respiratory systems, leading to life-threatening complications. Understanding the classification of poisons based on their action is essential for recognizing the signs and symptoms of poisoning and providing appropriate medical treatment. By identifying the specific actions of different poisons, healthcare professionals can effectively manage cases of poisoning and minimize the risk of adverse outcomes. Now, let's delve deeper into corrosive poisons and their classification. Corrosive poisons can be further classified into two main categories: acids and alkalis. Acids are corrosive substances that can cause damage to tissues through chemical action. Inorganic acids include compounds such as hydrochloric acid, HCl, sulfuric acid, H2SO4, and nitric acid, HNO3. These strong acids are commonly found in industrial settings and can cause severe burns or corrosion upon contact with living tissue. Organic acids, on the other hand, include compounds such as acetic acid, carboxylic acids, and salicylic acid. While these acids are typically less potent than their inorganic counterparts, they can still cause significant tissue damage and irritation if handled improperly. Moving on to alkalis, these are another category of corrosive substances that can cause tissue damage through chemical action. Alkalis can be further divided into hydroxides and carbonates. Hydroxides include compounds such as sodium hydroxide, potassium hydroxide, and ammonium hydroxide. These strong bases are commonly used in cleaning products, detergents, and industrial processes. Upon contact with living tissue, hydroxides can cause severe burns and tissue damage due to their caustic nature. Carbonates, including compounds such as sodium carbonate, potassium carbonate, and ammonium carbonate, are also considered corrosive alkalis. While less caustic than hydroxides, carbonates can still cause irritation and damage to tissues upon contact. Understanding the classification of corrosive poisons, including acids and alkalis, is essential for recognizing the potential hazards they pose and implementing appropriate safety measures to prevent exposure and minimize the risk of injury or harm. Let's now explore the classification of irritant poisons. Irritant poisons can be classified into several categories based on their composition and origin. Firstly, we have inorganic irritants. These include nonmetal and metal substances. Nonmetal inorganic irritants may include elements such as phosphorus, boron, fluorine, and chlorine. Exposure to these substances can cause irritation or damage to tissues upon contact. Metal inorganic irritants may include toxic metals such as arsenic, lead, and mercury. These metals can accumulate in the body over time and lead to chronic toxicity, causing symptoms ranging from skin irritation to neurological and systemic effects. Moving on to organic irritants, these can originate from plants, animals, or mechanical sources. Organic irritants from plants may include substances found in vegetables such as castor oil, calotropis, and capsicum, the active component in chili peppers. These substances can cause irritation or inflammation upon contact with skin, mucous membranes, or eyes. Organic irritants from animals may include venomous creatures such as snakes, spiders, and scorpions. Venom from these animals can contain toxins that cause local irritation, pain, swelling, or systemic effects upon envenomation. Lastly, mechanical irritants are substances that can cause irritation or injury through physical means. These may include materials such as nails, glass powder, needles, or other sharp objects that can penetrate the skin or mucous membranes, leading to irritation, injury, or infection. By identifying and addressing potential sources of irritation, we can help protect individuals from the adverse effects of irritant poisons. Let's now explore the classification of neurotoxic poisons. Neurotoxic poisons can be categorized based on their effects on the central nervous system, CNS, and the peripheral nervous system, PNS. Firstly, we have cerebral neurotoxins, which affect the CNS. These include narcotic-based substances such as opium, morphine, and codeine. These substances act as depressants on the CNS, leading to sedation, pain relief, and euphoria. Inebriants, such as alcohol and certain anesthetic agents, can also have neurotoxic effects on the CNS, impairing cognitive function and motor coordination. Additionally, substances classified as deliriants, such as cannabis, cocaine, and camphor, can induce hallucinations, confusion, and delirium by disrupting normal neurotransmitter function in the brain. Moving on to spinal neurotoxins, these substances affect the PNS. One example is Nux vomica and its derivatives, which contain the deadly substances strychnine and brucine. Strychnine is highly toxic and can cause convulsions and death by blocking inhibitory neurotransmitters in the spinal cord. Brucine, although less toxic than strychnine, can still cause poisoning when ingested alongside strychnine. Another example of a neurotoxic substance is curare, which affects the peripheral nervous system. Curare is a plant-derived toxin that acts as a neuromuscular blocking agent, causing paralysis by blocking acetylcholine receptors at the neuromuscular junction. This paralysis can lead to respiratory failure and death if not promptly treated. By identifying the specific neurotoxic mechanisms of different substances, healthcare professionals can effectively manage cases of poisoning and minimize the risk of adverse outcomes. Let's now explore the classification of cardiac and respiratory poisons. Cardiac poisons are substances that directly affect the heart, leading to abnormalities in heart rhythm, cardiac function, and potentially organ failure. One example of a cardiac poison is aconite, also known as monkshood or wolfsbane. Aconite contains alkaloids that can cause severe cardiac toxicity, including arrhythmias, bradycardia, and cardiac arrest, which can be fatal if not promptly treated. Another example is digitalis, derived from the foxglove plant. Digitalis glycosides, such as digoxin and digitoxin, are used medically to treat heart conditions like congestive heart failure and atrial fibrillation. However, excessive doses can lead to digitalis toxicity, characterized by cardiac arrhythmias, bradycardia, and visual disturbances. Tobacco contains nicotine, a potent cardiac stimulant that can increase heart rate, blood pressure, and cardiac output. Chronic tobacco use is associated with an increased risk of cardiovascular diseases, including heart attack, stroke, and peripheral artery disease. Respiratory poisons, on the other hand, are substances that directly affect the respiratory system, leading to respiratory distress, respiratory failure, and potentially death. Carbon monoxide is a common respiratory poison that can be found in household appliances like gas stoves, furnaces, and car exhaust. Carbon monoxide binds to hemoglobin in red blood cells, reducing oxygen transport to tissues and causing symptoms such as headache, dizziness, and eventually loss of consciousness and death. Other respiratory poisons include carbon dioxide, sulfur dioxide, tear gas, and chlorine gas. These substances can irritate the respiratory tract, leading to coughing, shortness of breath, chest tightness, and respiratory failure in severe cases. Now, let's discuss general treatments for poisoning. When the specific nature of the poison is unknown or in cases where immediate identification is not feasible, general treatments are administered. These treatments aim to stabilize the patient and mitigate the effects of poisoning until further information or specific antidotes are available. The first step in treating poisoning is to assess the patient based on their presentation of signs and symptoms, including any complaints of pain, discomfort, or altered mental status. Loss of consciousness is a critical indicator that requires immediate attention. To assess the severity of unconsciousness, healthcare professionals may use grading systems such as Reid's classification or the Glasgow Coma Scale. One crucial aspect of treatment is the prompt removal of the source of exposure. This may involve removing the patient from the contaminated environment, discontinuing exposure to the toxic substance, or administering antidotes if available. In cases where the specific poison is unknown, supportive care measures are typically initiated. These may include maintaining airway patency, providing supplemental oxygen or mechanical ventilation as needed, ensuring adequate hydration and electrolyte balance, and monitoring vital signs and organ function closely. Additionally, symptomatic treatment may be administered to alleviate specific symptoms or complications associated with poisoning. This could involve the use of medications to control pain, nausea, vomiting, seizures, or cardiac arrhythmias, depending on the patient's clinical presentation. Now, let's discuss Reid's classification, a system used to grade the level of consciousness in poison patients. Reed's classification provides a framework for assessing the severity of unconsciousness based on the patient's responsiveness to stimuli. It consists of 4 grades. Grade I. In this grade, the patient is drowsy but still responds to verbal stimuli. They may exhibit signs of drowsiness or confusion but can still be aroused by speaking to them. Grade II. In Grade II, the patient is unconscious but responds to stimuli. Despite being unconscious, they can respond to physical stimuli such as touch or pain. This may involve moving or reacting to external stimuli without regaining consciousness. Grade III. Patients in Grade III are unconscious and only respond to a very painful stimulus. They do not respond to verbal commands or light touch, but may react to a strong, painful stimulus, such as pressure or pinching. Grade IV. This is the most severe grade, where the patient is unconscious and does not give any responses. In Grade IV, there is no response to any stimuli, including verbal commands, touch, or pain. Reed's classification provides healthcare professionals with a standardized method for assessing the level of consciousness in poison patients, allowing for accurate monitoring and appropriate intervention. By identifying the severity of unconsciousness, healthcare providers can tailor treatment strategies to address the specific needs of each patient and optimize outcomes. Now let's discuss the Glasgow Coma Scale, an important neurological assessment tool used in the evaluation of a person's level of consciousness. The Glasgow Coma Scale, or GCS, is a standardized method for assessing neurological function based on eye opening, verbal response, and motor response. It provides a numerical score ranging from 3 to 15, with higher scores indicating a higher level of consciousness. In the GCS, eye opening is assessed on a scale from 1 to 4, verbal response from 1 to 5, and motor response from 1 to 6. The total score is obtained by summing the scores from each category. The scale is useful in various clinical settings, including emergency medicine, intensive care units, and neurology. It helps healthcare providers objectively evaluate and monitor changes in a patient's level of consciousness over time. The Glasgow Coma Scale is particularly valuable in assessing conditions such as traumatic brain injury, stroke, and other neurological emergencies. By accurately measuring and tracking a patient's neurological status, healthcare providers can make informed decisions regarding treatment and intervention strategies. Let's discuss the general treatment of poisoning, which aims to remove the poison from further absorption into the body, treat the condition, and facilitate the elimination of absorbed poison from the system. The general treatment of poisoning involves several key steps. 1. Removal of unabsorbed poison. The first step is to prevent further absorption of the poison by removing any remaining substance from the patient's environment or gastrointestinal tract. This may involve inducing vomiting, administering activated charcoal to absorb toxins in the gastrointestinal tract, or performing gastric lavage, stomach pumping, under medical supervision. 2. Administer antidotes. In cases where specific antidotes are available for the poison involved, they should be administered promptly to counteract the toxic effects. Antidotes work by neutralizing or reversing the effects of the poison in the body, helping to restore normal physiological function and minimize harm. 3. Eliminate absorbed poison from the system. Once the poison has been absorbed into the body, efforts should be made to facilitate its elimination through various routes, such as urine, feces, or sweat. This may involve administering medications or treatments to enhance excretion, such as diuretics or chelating agents. 4. Treating the condition. In addition to addressing the toxic effects of the poison, it's essential to treat any associated medical conditions or complications that may arise. This may include providing supportive care to stabilize vital signs, managing symptoms such as pain or respiratory distress, and addressing any organ dysfunction or damage caused by the poisoning. 5. Providing general care. Throughout the treatment process, it's important to monitor the patient closely and provide general supportive care to optimize their recovery. This may include maintaining airway patency, ensuring adequate hydration and nutrition, monitoring vital signs, and addressing any psychological or emotional distress. By following these steps in the general treatment of poisoning, healthcare providers can effectively manage cases of poisoning, minimize the absorption and effects of toxic substances, and promote the patient's recovery and well-being. Let's discuss the first steps to take for treatment based on the type of poisoning. 1. Inhaled poison. If the patient has been exposed to an inhaled poison, The first priority is to remove them from the contaminated environment and bring them to an open area with fresh air. Ensure the patient's airway is clear from any obstruction, and if necessary, provide assistance with artificial respiration and supply oxygen to support breathing. 2. Snake bite or injection. In cases of snake bite or injection of poison, immediate action is crucial. Use tourniquets to immobilize the affected limb or area to prevent the spread of venom. Apply an ice pack to the affected area to reduce swelling and pain. It's important to seek medical attention promptly for further evaluation and treatment. 3. Contact with poisons. If the poison has come into contact with the skin or mucous membranes, the affected area should be washed thoroughly with plenty of water to remove any remaining toxin. Apply antiseptic to the area to prevent infection and minimize the risk of further absorption. 4. Ingestion of poisons. In cases of ingestion of poison, the timing of treatment is critical. If ingestion occurred within the last 4 to 6 hours, it may be appropriate to induce vomiting to remove the ingested poison from the stomach. However, this should only be done under the guidance of medical professionals, as induced vomiting can be harmful in certain situations. Gastric lavage, or stomach pumping, may also be performed under medical supervision to remove toxins from the stomach. These initial steps are essential for managing poisoning emergencies and minimizing the absorption and effects of toxic substances. However, it's important to remember that these actions should be followed by appropriate medical evaluation and treatment by healthcare professionals to ensure the best possible outcome for the patient. Let's delve into the different types of antidotes used in the treatment of poisoning. 1. Physical and mechanical antidotes. These antidotes work by physically removing the poison from the body using various methods. For example, demulcents soothe and protect the mucous membranes, bulky foods absorb toxins in the gastrointestinal tract, and activated charcoal binds to toxins and prevents their absorption into the bloodstream. 2. Chemical antidotes. Chemical antidotes react with the poison to change its structure and reduce its harmful effects. For instance, acids can neutralize alkali poisons, and sodium thiosulfate can counteract cyanide poisoning by forming a less toxic compound. 3. Pharmacological and physiological antidotes. These antidotes counteract the effects of the poison by producing opposite physiological responses. For example, atropine is used to treat organophosphate poisoning by blocking the action of acetylcholine, and naloxone reverses the effects of opioids by competitively binding to opioid receptors. 4. Chelating agents. Chelating agents bind to metal ions in the body to prevent their absorption and facilitate their excretion. Dimercaprol is used for heavy metal poisoning, such as lead or arsenic, while EDTA is employed for chelating excessive minerals like calcium or iron. 5. Universal antidote. This antidote comprises a combination of activated charcoal, magnesium oxide, and tannins, which can be administered in cases of unknown poisonings to help absorb toxins and neutralize their effects. 6. Household antidotes. Common household items may also possess antidote effects. For example, milk can neutralize acidic poisons, charcoal can adsorb toxins in the gastrointestinal tract, bananas can help replenish potassium levels in cases of poisoning, and vinegar can be used to treat alkaline burns. Let's discuss physical and mechanical antidotes, which include demulcents, bulky foods, and activated charcoal. 1. Demulcents. Demulcents form an oily layer on the lining of the gastric mucous membrane, which helps to prevent the absorption of toxins in the gastrointestinal tract. Common examples of demulcents include oils, ghee, butter, and starch solutions. It's important to note that demulcents are contraindicated in cases of phenol, phosphorus, or kerosene poisoning, as these substances are soluble in oils and may exacerbate the toxic effects. 2. Bulky foods. Bulky foods work by engulfing the poisonous substance, thereby reducing its availability for absorption and minimizing its unwanted effects. Examples of bulky foods include bananas, boiled rice, flour suspensions, and mashed potatoes. By consuming bulky foods, patients can help dilute the concentration of toxins in the gastrointestinal tract and facilitate their expulsion from the body. 3. Activated charcoal. Activated charcoal is a highly effective antidote that works by adsorbing toxins in the gastrointestinal tract, preventing their absorption into the bloodstream. It is administered orally in the form of a suspension, typically at a dose of 1 to 2 grams per kilogram of body weight, mixed with 8 milliliters of diluent per gram. Activated charcoal is widely used in the management of poisoning cases due to its ability to rapidly and efficiently bind to a wide range of toxins, including drugs, chemicals, and ingested poisons. These physical and mechanical antidotes play a crucial role in the treatment of poisoning by helping to prevent the absorption of toxins in the gastrointestinal tract, reduce their availability for systemic circulation, and facilitate their elimination from the body. By employing these antidotes in the appropriate clinical setting, healthcare providers can effectively mitigate the toxic effects of ingested substances and improve patient outcomes. Let's delve into chemical antidotes, which are substances that chemically react with poisons to change their chemical structure and neutralize their effects. 1. Acid poisoning. In cases of acid poisoning, chemical antidotes such as calcium and magnesium oxide can be administered. These substances react with the acid, forming salts and water, thereby reducing the acidity of the solution and mitigating its corrosive effects on tissues. 2. Alkali poisoning. For alkali poisoning, chemical antidotes like acetic acid, vinegar, or lime juice can be employed. These acidic substances neutralize the alkali by forming salts, helping to reduce its caustic effects on tissues and restore normal pH balance. 3. Lead poisoning. Chemical antidotes for lead poisoning include substances like sodium and magnesium sulfate. These compounds work by binding to lead ions in the body, forming insoluble complexes that are excreted from the body, thereby reducing lead toxicity. 4. Cyanide poisoning. Sodium thiosulfate is commonly used as a chemical antidote for cyanide poisoning. It reacts with cyanide ions to form thiocyanate, which is less toxic and can be excreted from the body, thereby reducing cyanide toxicity. 5. Arsenic poisoning. Hydrated ferric oxide is a chemical antidote used for arsenic poisoning. It forms a complex with arsenic ions, reducing their availability for absorption and toxicity. 6. Mercury poisoning. Sodium formaldehyde sulfoxylate is utilized as a chemical antidote for mercury poisoning. It reacts with mercury ions to form a complex that is less toxic and can be excreted from the body, thereby reducing mercury toxicity. Now let's explore pharmacological and physiological antidotes, which are substances that exert pharmacologically opposite actions compared to the poison, thereby counteracting its effects. In cases of organophosphorus poisoning, atropine is commonly used as a pharmacological antidote. Atropine acts by blocking the action of acetylcholine at muscarinic receptors, thereby counteracting the excessive stimulation of the parasympathetic nervous system caused by organophosphorus compounds. Naloxone is employed as a pharmacological antidote for opium and morphine poisoning. Naloxone is an opioid antagonist that competes with opioids for binding to opioid receptors, effectively reversing their effects and restoring normal respiratory and central nervous system function. Next, ethyl alcohol, or ethanol, is used as a pharmacological antidote for methanol poisoning. Ethanol competes with methanol for the same metabolic pathways in the liver, leading to the formation of less toxic metabolites and reducing the formation of toxic byproducts such as formaldehyde and formic acid. On the other hand, N-acetylcysteine, NAC, serves as a pharmacological antidote for paracetamol poisoning. NAC replenishes depleted glutathione levels in the liver, which are essential for detoxifying the reactive metabolite of paracetamol, thereby preventing liver damage and improving patient outcomes. Next, let's delve into chelating agents, which are substances that bind tightly to metal ions, preventing their absorption in the gastrointestinal tract and facilitating their elimination from the body. Dimercaprol, also known as British anti-leucite, BL, is administered via intramuscular injection for the treatment of heavy metal poisoning, including mercury, lead, arsenic, and gold poisoning. It is typically injected into the muscles at a dose of 3 milligrams per kilogram body weight, using a 10% solution of peanut oil as a vehicle. Dimercaprol forms stable complexes with heavy metal ions, allowing them to be excreted from the body and reducing their toxic effects. EDTA is a chelating agent that can be administered orally or intravenously to remove excessive heavy metals and minerals from the body. It is typically administered intravenously at a dose of 5 milliliters of a 50% solution twice daily, or orally at a dose of 1 milligram per kilogram body weight twice daily for a duration of 5 days. EDTA binds to metal ions such as lead, mercury, and cadmium, forming stable complexes that are excreted via the kidneys, thereby reducing metal toxicity. Next, cupramine, also known as penicillamine, is administered orally on an empty stomach for the treatment of copper poisoning. It is typically prescribed at a dose of 30 milligrams per kilogram body weight for a course of 5 to 10 days. Cupramine forms complexes with copper ions, promoting their excretion from the body and reducing copper toxicity. These chelating agents play a crucial role in the treatment of heavy metal poisoning by binding to metal ions and facilitating their elimination from the body. By administering the appropriate chelating agent based on the type of metal poisoning involved, healthcare providers can effectively mitigate toxicity and improve patient outcomes. Now let's explore the concept of a universal antidote, which can be utilized in cases of poisoning where the specific nature of the poison is unknown or in situations where multiple toxins may be present. The universal antidote is formulated to address a wide range of poisons and is typically administered orally. The recommended dosage is 15 to 30 milligrams every 12 hours or once daily, depending on the severity of poisoning and the patient's condition. Charcoal is highly effective in absorbing toxins due to its porous structure. In the universal antidote, charcoal derived from burned bread serves as the primary component for absorbing various poisons present in the gastrointestinal tract. Next, we have magnesium oxide, which acts to neutralize acidic and alkaline toxins, thereby helping to mitigate their harmful effects. It serves as a buffer to maintain physiological pH balance and counteract the acidic or alkaline nature of toxins. Tannins are polyphenolic compounds found in tea that have astringent properties and can precipitate certain toxins, including metals, alkaloids, and glucosides. Additionally, tannins aid in neutralizing alkalis, further contributing to the detoxification process. By combining these three components, the universal antidote provides a comprehensive approach to neutralizing a wide range of toxins and promoting their elimination from the body. It serves as a valuable tool in the management of poisoning cases where the specific nature of the poison is unknown or in situations where multiple toxins may be present. Now let's explore household antidotes, which are readily available items found in most homes that can be used as initial treatments for poisoning before medical help arrives. Milk is commonly taken orally as a general antidote for ingested poisoning. It helps to dilute toxins and coat the stomach lining, reducing their absorption into the bloodstream. Charcoal derived from burned bread can be used as a physical antidote. Its porous structure allows it to absorb toxins in the gastrointestinal tract, reducing their absorption and mitigating their effects. Bananas and potatoes are examples of physical antidotes. These foods can help absorb toxins and reduce their availability for absorption in the gastrointestinal tract. Common salt, sodium chloride, and mustard powder are household items that can act as emetic agents, inducing vomiting to expel ingested toxins from the stomach. Starch solution can be used as an antidote for iodine poisoning. It helps to dilute and neutralize excess iodine, reducing its toxic effects. Vinegar, lime, or lemon juice can be used as household antidotes for alkali poisoning. The acidic nature of these substances helps to neutralize alkalis, reducing their corrosive effects on tissues. These household antidotes can provide immediate relief and aid in the initial management of poisoning cases before professional medical assistance is obtained. However, it's essential to seek medical attention promptly for proper evaluation and treatment. Let's talk about barbiturate poisoning, a serious medical condition often resulting from accidental or intentional overdoses. Barbiturate overdose commonly occurs accidentally due to medication errors or intentionally as a result of suicide attempts. The availability and prescription of barbiturates for various medical conditions contribute to their potential for misuse and overdose. Barbiturates exert their effects primarily by depressing the central nervous system, leading to symptoms such as drowsiness, confusion, and impaired coordination. In severe cases of poisoning, profound depression of the respiratory center in the brainstem can result in respiratory failure and coma. Patients with barbiturate poisoning may exhibit signs of peripheral circulatory collapse, including a weak and rapid pulse, shallow and rapid breathing, and cold, pale skin. These manifestations reflect the profound physiological effects of barbiturates on cardiovascular function. Barbiturate poisoning carries significant mortality risk, with fatal outcomes often attributed to complications such as lung collapse, atelectasis, or acute renal failure. The respiratory depression induced by barbiturates can lead to inadequate oxygenation of tissues and subsequent respiratory arrest, contributing to morbidity and mortality. Barbiturate poisoning represents a medical emergency requiring prompt intervention and supportive care. Early recognition of symptoms, aggressive management of airway and ventilation, and administration of antidotes when available are essential for improving outcomes in affected individuals. Additionally, efforts to address underlying mental health issues and prevent future episodes of overdose are crucial components of comprehensive management strategies. Now move on to the treatments available for barbiturate poisoning, a potentially life-threatening condition requiring urgent medical intervention. 1. Gastric lavage or stomach pumping should be performed as soon as possible, ideally within 1 hour of barbiturate ingestion. This procedure involves flushing the stomach with a saline solution to remove any remaining toxins and prevent further absorption into the bloodstream. 2. Emetic agent. In cases where gastric lavage is not feasible or contraindicated, an emetic agent such as concentrated salt solution may be administered to induce vomiting and expel the ingested barbiturates from the stomach. 3. Activated charcoal. Activated charcoal is an effective antidote for absorbing toxins in the gastrointestinal tract. It should be administered orally every 4 hours to help reduce the absorption of barbiturates and facilitate their elimination from the body. 4. Endotracheal intubation. In cases where respiratory function is severely compromised, endotracheal intubation may be necessary to maintain adequate ventilation and oxygenation. This intervention helps prevent respiratory failure and its associated complications. 5. Forced diuresis. Forced diuresis may be considered in cases of severe barbiturate poisoning, particularly when the dose ingested is high and other treatments have been ineffective. This procedure involves administering intravenous fluids and diuretic medications to increase urine output and facilitate the excretion of barbiturates from the body. Mannitol and furosemide. Mannitol, given intravenously along with furosemide, helps promote diuresis and enhance the elimination of barbiturates through the urine. The goal is to achieve a target urine output of 10 to 20 liters within 24 hours to facilitate toxin clearance. Lastly, dialysis. In severe cases of barbiturate poisoning where other treatments have failed, dialysis may be necessary to remove toxins directly from the bloodstream. Dialysis is highly effective in clearing barbiturates from the body and can be considered when forced diuresis is insufficient or contraindicated. In summary, prompt and aggressive medical intervention is essential in the management of barbiturate poisoning to prevent life-threatening complications and improve patient outcomes. Treatment strategies may include gastric lavage, administration of activated charcoal, respiratory support with endotracheal intubation, forced diuresis, and, in severe cases, dialysis. Early recognition of symptoms and timely initiation of appropriate treatments are crucial for optimizing patient care and reducing the risk of morbidity and mortality associated with barbiturate poisoning. Next, alcohol poisoning. We are going to focus primarily on ethanol, its effects on the body, and the implications for medical management. Ethanol, also known as ethyl alcohol, is the primary type of alcohol associated with alcohol poisoning. It's the same alcohol found in alcoholic beverages and is responsible for the intoxicating effects commonly experienced when drinking. While ethanol is the most common cause of alcohol poisoning, it's essential to recognize that other types of alcohol can also lead to poisoning. These include methanol, isopropyl alcohol, IPA, and ethylene glycol. Each of these substances has its own toxic effects and requires specific management approaches. Ethanol exerts its effects on various tissues and organs in the body. It directly impacts the cardiac muscle, thyroid tissue, and hepatic, liver, tissue, contributing to both acute and chronic health consequences. One notable characteristic of ethanol is its rapid absorption into the bloodstream. After ingestion, ethanol is quickly absorbed from the gastrointestinal tract, leading to a rapid increase in blood alcohol concentration. The peak serum concentration typically occurs approximately 1 hour after ingestion, contributing to the swift onset of intoxication and its associated effects. Ethanol exerts its primary effects on the central nervous system, where it binds directly to gamma-aminobutyric acid, GABA, receptors. This interaction results in the suppression of neuronal activity, leading to sedative effects such as relaxation, drowsiness, and impaired cognitive and motor function. These sedative effects contribute to the characteristic symptoms of alcohol intoxication, including slurred speech, impaired coordination, and altered mental status. Understanding the pharmacological properties of ethanol and its effects on the body is crucial for recognizing and managing alcohol poisoning effectively. Prompt medical intervention, including supportive care, monitoring, and, in severe cases, specific antidotal therapy, is essential for preventing complications and improving outcomes in individuals with alcohol poisoning. Now let's delve into the stages of acute alcohol poisoning, each characterized by distinct symptoms and manifestations. Stage 1, that is the stage of excitement. In this initial stage, typically occurring at blood alcohol concentrations, BAC, ranging from 50 to 100 milligrams per deciliter, 0.05 to 0.1%, individuals may experience heightened emotions and a sense of pleasure. They may appear euphoric or excited, with flushed faces and dilated pupils. Additionally, their breath may carry the characteristic odor of alcohol, a telltale sign of intoxication. Stage 2, which is the stage of incoordination. As alcohol levels continue to rise, entering the range of 100 to 300 milligrams per deciliter, 0.1 to 0.3%, individuals progress to the stage of incoordination. Here, symptoms manifest as impaired cognitive and motor function, leading to difficulties in speech, thought, and action. Common signs include confusion, memory impairment, and a staggering gait. Vision may become blurred, further complicating coordination and movement. Let's continue exploring the stages of acute alcohol poisoning, focusing on the latter stages and their associated symptoms. On stage 3, stage of narcosis, as alcohol levels further elevate, reaching concentrations between 300 to 500 milligrams per deciliter, 0.3 to 0.5%, individuals enter the stage of narcosis. Characterized by deep sedation and profound sinus depression, this stage is marked by a state of deep sleep. Individuals may exhibit excessive salivation, along with physiological changes such as an increased pulse rate, contracted pupils, and a decrease in body temperature. At stage 4, which is the stage of medullary paralysis, at the highest levels of alcohol intoxication, exceeding 500 milligrams per deciliter, greater than 0.5%, individuals progress to the state of medullary paralysis. This stage represents a critical juncture where the CNS depression reaches its peak, leading to significant impairment of vital functions controlled by the medulla oblongata, the lower part of the brainstem. Symptoms include a markedly slowed respiratory rate, often accompanied by cyanosis, bluish discoloration of the skin due to oxygen deprivation, and cold, clammy skin. Pupil dilation may occur alongside very low pulse rates, reflecting severe depression of neurological and cardiovascular function. As individuals progress through these advanced stages of acute alcohol poisoning, the risk of life-threatening complications, including respiratory failure and cardiac arrest, becomes imminent. Prompt medical intervention is essential to stabilize vital functions, provide supportive care, and prevent further deterioration. Recognizing the symptoms associated with each stage is critical for initiating appropriate interventions and optimizing outcomes for individuals experiencing alcohol poisoning. Next, the wide-ranging symptoms associated with alcohol poisoning, encompassing both acute and chronic manifestations. Prolonged and excessive alcohol consumption can lead to a spectrum of chronic health conditions, including gastritis, inflammation of the stomach lining, pancreatitis, inflammation of the pancreas, fatty liver disease, and cirrhosis, scarring of the liver tissue. These conditions result from the toxic effects of alcohol on various organs and tissues over time, contributing to significant morbidity and mortality. Alcohol poisoning can profoundly impact mental well-being, leading to a range of cognitive and psychiatric symptoms. These may include memory loss, acute episodes of psychosis or insanity, insomnia, and an increased risk of suicidal thoughts and behaviors. Chronic alcohol abuse can exacerbate underlying mental health conditions and impair overall cognitive function, posing significant challenges to affected individuals' quality of life and interpersonal relationships. Pregnant individuals who consume alcohol excessively place their unborn babies at risk of fetal alcohol spectrum disorders, FASTs. Babies born to mothers who engage in heavy drinking during pregnancy may experience various developmental and cognitive impairments, including intellectual disabilities, behavioral problems, and growth deficiencies. Fetal alcohol exposure can have lifelong consequences, highlighting the importance of alcohol abstinence during pregnancy to ensure optimal fetal development and well-being. Ingestion of methanol, a toxic alcohol commonly found in industrial solvents and antifreeze, can lead to severe poisoning and potentially fatal complications. Symptoms of methanol poisoning may include abdominal cramps, muscular weakness, depressed cardiac and respiratory function, blurred or complete blindness, and altered mental status ranging from confusion to unconsciousness and coma. Without prompt medical intervention, methanol poisoning can progress rapidly and result in death, underscoring the critical importance of timely recognition and treatment of this hazardous condition. When it comes to treating alcohol poisoning, the approach varies depending on the type of alcohol involved and the severity of the intoxication. For intoxication due to ethanol or isopropanol, the primary focus of treatment is on providing supportive care to maintain vital functions and prevent complications. Ensuring clear airways and adequate breathing is paramount, as respiratory depression can occur. Intravenous fluids are often administered to prevent dehydration and maintain electrolyte balance. Additionally, glucose and thiamine supplementation may be necessary, as prolonged alcohol ingestion can deplete these nutrients, leading to potential neurological complications. For methanol poisoning, the treatment strategy differs due to the unique toxic effects of methanol and its metabolites. One approach involves administering ethanol orally or intravenously at a specific dose and concentration. Ethanol competes with methanol for binding sites on alcohol dehydrogenase enzymes, thereby inhibiting the conversion of methanol into its toxic metabolites. Alternatively, for methylpyrazole, a specific antidote for methanol poisoning may be administered to block the activity of alcohol dehydrogenase directly. In both cases, close monitoring of the patient's vital signs and neurological status is essential, along with prompt medical intervention to address any complications that may arise. Collaboration between healthcare providers, toxicologists, and poison control centers can facilitate optimal management and improve patient outcomes in cases of alcohol poisoning. Let's talk about morphine poisoning. Morphine, derived from the opium poppy plant Papaver somniferum, is a potent phenanthrene alkaloid classified as a narcotic analgesic. It's widely used to manage both mild and severe pain due to its powerful pain-relieving properties. However, its potency and potential for addiction make it a substance of concern when used improperly or in excessive amounts. When morphine is ingested or administered, it acts on specific receptors in the central nervous system, particularly in the brain and spinal cord, to alleviate pain and induce feelings of euphoria. While it can effectively manage pain when used as prescribed under medical supervision, misuse or abuse of morphine can lead to tolerance, dependence, and addiction. In cases of morphine poisoning, individuals may experience a range of symptoms depending on the dose ingested and their tolerance level. Morphine poisoning progresses through distinct stages, each characterized by specific symptoms and effects on the body. Stage I: excitement and euphoria. In this initial stage, individuals may experience an increase in mental activity, a sense of well-being, and sometimes even hallucinations. Additionally, there may be flushing of the face and, in children, episodes of convulsions. It's important to note that the euphoric effects of morphine are short-lived, often leading individuals to seek additional doses to maintain the desired effects. Stage II: stage of stupor or depression. As morphine levels continue to rise in the body, individuals may enter a state of stupor or depression. Symptoms in this stage can include headaches, nausea, vomiting, and drowsiness. Physical signs such as contracted pupils, a cyanotic, bluish complexion, and itching of the body may also be present. This stage reflects the depressant effects of morphine on the central nervous system. Stage III: narcosis, coma. In the final stage of morphine poisoning, individuals may progress into a deep coma. Muscles become relaxed, blood pressure drops, hypotension, body temperature decreases, hypothermia, and the skin may take on a bluish tint due to cyanosis. Pupils become unresponsive and remain pinpoint in size. This stage represents a critical state requiring immediate medical intervention to prevent further complications and potential death. Recognizing the symptoms of morphine poisoning and understanding the progression of its stages is crucial for prompt identification and appropriate medical management. Early intervention can greatly improve the chances of recovery and reduce the risk of severe consequences associated with morphine overdose. Treatment for morphine poisoning involves a combination of supportive measures and specific antidotes aimed at mitigating the effects of the poison on the body. The first step in treatment is often gastric lavage, a procedure to remove any unabsorbed morphine from the stomach. This helps prevent further absorption into the bloodstream and reduces the overall impact of the poison. Administering activated charcoal is another common intervention, particularly for opiate ingestion. Activated charcoal binds to the poison in the stomach, preventing its absorption into the bloodstream and facilitating its elimination from the body. Enemas and purgatives may be used to help eliminate any morphine that has already been absorbed into the system. These measures promote bowel movements and facilitate the removal of the poison from the body. In cases where the patient's breathing is compromised, endotracheal intubation may be necessary to ensure an adequate airway and assist with ventilation. This procedure helps maintain oxygenation and prevents further respiratory complications. Naloxone, an opioid antagonist, is the primary antidote for morphine poisoning. It works by competitively blocking the effects of morphine at opioid receptors, thereby reversing the depressant effects on the central nervous system. Naloxone is typically administered intravenously in repeated doses until the patient regains consciousness and respiratory function improves. Methadone, a synthetic opioid, may be prescribed to manage withdrawal symptoms in individuals who are dependent on morphine. Methadone helps alleviate cravings and stabilizes patients during the detoxification process. Overall, the treatment approach for morphine poisoning focuses on removing the poison from the body, supporting vital functions such as breathing, and administering specific antidotes to counteract the effects of the poison on the central nervous system. Prompt medical intervention and close monitoring are essential for ensuring a successful outcome and preventing complications associated with morphine overdose. Snake bites are a significant concern worldwide, with thousands of species of snakes found across various habitats. These reptiles vary widely in size, behavior, and venom potency, making snake bites a diverse and complex issue. The venom injected by snakes is a potent cocktail of over 20 different constituents, including proteins, enzymes, and polypeptide toxins. Each component of snake venom plays a distinct role in disrupting physiological processes within the victim's body. The effects of snake venom can be profound and multifaceted. Some components promote blood clotting, leading to thrombosis and ischemia, while others damage blood vessel walls, causing hemorrhage and tissue necrosis. Additionally, certain toxins directly attack cells and tissues, leading to organ damage and dysfunction. Moreover, venom components can interfere with neurotransmitters, causing neurological symptoms and systemic effects. Given the diverse and complex nature of snake venoms, proper first aid and prompt medical treatment are crucial for snake bite victims. Immediate steps such as immobilizing the affected limb, keeping the victim calm and still, and seeking medical assistance without delay can significantly improve outcomes. Antivenom therapy, which targets specific venom components, is often administered to neutralize the effects of snake venom and mitigate systemic toxicity. Let's talk about snake venoms. Snake venoms are complex cocktails containing a diverse array of constituents, including proteins, enzymes, and polypeptide toxins. These components contribute to the venom's multifaceted effects on the human body. Procoagulant enzymes found in some snake venoms promote blood clotting, initiating the coagulation cascade. However, certain viper venoms can rapidly deplete clotting factors, leading to a state where blood fails to clot, increasing the risk of hemorrhage and uncontrolled bleeding. Hemorrhagens are another component of snake venoms that damage the endothelial cells lining blood vessels, resulting in spontaneous systemic hemorrhage. This can lead to widespread bleeding and compromise the circulatory system. Snake venoms also contain cytolytic and necrotic toxins, which have destructive effects on cells and tissues. These toxins, acting as digestive hydrolases, can lead to local swelling, tissue necrosis, and the destruction of cell membranes. Neurotoxins present in certain snake venoms interfere with neurotransmitters and disrupt neuronal function. This can result in neurological symptoms such as paralysis, respiratory failure, and potentially death. Understanding these components is crucial for developing effective treatments and interventions for snakebite envenomation. When dealing with snakebite cases, it's crucial to remember the acronym right for the correct first aid response. First, reassure the victim, as the majority of snake bites are from non-venomous snakes, which can alleviate anxiety. Next, immobilize the affected limb, treating it as if it were fractured. Avoid applying compression or pressure and refrain from blocking blood supply to the area. Then, swiftly get the patient to a hospital for further evaluation and treatment by medical professionals. Upon arrival, inform the doctor about the symptoms and provide any information about the snake species if possible. Snake bites often cause severe pain, which can be managed with painkillers such as paracetamol. Avoid aspirin or NSAIDs, as they can exacerbate coagulation issues. Administering antivenom is crucial for venomous snake bites. Polyvalent antivenom is effective against species like the Russell's viper and common cobras, neutralizing the venom's effects. By following these steps and promptly seeking medical assistance, the chances of a favorable outcome for snakebite victims can be significantly improved. Now we have come to our end for this session. As we conclude our session on poisons and antidotes, I trust you've gained valuable insights. Remember, knowledge of these substances and their treatments can be life-saving. Until we convene for our next class, I wish you all the best. Stay curious, stay safe, and keep learning. Thank you, and have a wonderful day ahead.